Hello, this is Liam, and today I'm going to be doing my hip palpations on my friend Jeff here again. So starting off, we have the iliac crest right up here, and we're going to use that to find our anterior superior iliac spine. Moving a little bit further down, we're going to get to the anterior inferior iliac spine. Then, turn around real quick. We're going to use that iliac spine again, and we're going to find the posterior superior iliac spine. And turning around once more, we're going to use that iliac crest again and push in a little bit, and we're going to find the iliac fossa. Now, on the back side here, we have the ischial tuberosity, of the ischium. And right on the sides here, we have the greater trochanter, which we can use to find the lesser trochanter slightly below. Turning around once more, not going to touch here, but would be the pubis bone. And turning around once, sorry, I keep having you turn around. Right on the femur here, we have the pectineal line, which is right on the medial aspects of the posterior. Then we have the intertrochanteric line, which is on the front side here between the greater trochanter and the lesser trochanter. And we have the crest, which is on the back side right here. And then on the middle of our femurs, on the posterior side, we have the linea aspera. And up here, we are going to be able to palpate the coxofemoral joint, which is the hip, and the sacroiliac joint, which is right up. Hold on. Just orientate myself right in here. Now, moving to our muscles, we have the sartorius, which runs from the ASIS down to the pezanserine, which helps in flexion of the hip, external rotation, and abduction. We also have the rectus femoris, which also runs from the ASIS and down into the tibial tuberosity, which also helps with hip flexion. Next, we have the pectineus, which originates at the pubis and inserts at the pectineal line, and this helps with hip adduction. We also have the iliacus, which helps, which originates at the iliac fossa and inserts at the lesser trochanter, which is down here. This helps with hip flexion. We have the psoas major, which helps with hip flexion, and it originates at the lumbar spine down here and inserts at the lesser trochanter down here. Next, we have the bicep femoris, which has two origins, both the ischial tuberosity and the linea aspera, which inserts down in the lateral tibial condyles, and this helps with hip extension. We also have the semitendinosus and semimembranosus. Semitendinosus originates at the ischial tuberosity and inserts at the pezanserine. And we also have the semimembranosus, which originates at the ischial tuberosity as well and inserts at the medial tibial condyle. And these help with hip extension. And then also back here, we have the gluteus maximus, which is responsible for hip extension as well as external rotation. And that origin is at the sacrum and coccyx, and as well as the posterior gluteal line of the ilium. And it has an insertion at the gluteal line of the femur, which is right in here, and the IT band, which runs down his leg here. Also, we have the gluteus maximus and the gluteus minimus, which are both responsible for hip abduction. But the medius is also responsible for internal rotation. The medius has an origin at the iliac crest and the gluteal lines of the ilium, and it inserts at the greater trochanter right here. The minimus has an origin at the anterior and inferior gluteal lines of the ilium and inserts at the greater trochanter as well. Next up, we have the tensor fasciae latae, which has an origin at the iliac crest up here. And it also inserts into the greater trochanter and down into the IT band. The tensor fasciae latae has 3 movements that it's responsible for, which is hip flexion, abduction, and internal rotation of the hip. Now, moving back to the front here, we have the adductors. The first one is the adductor longus, which originates at the pubic bone and inserts at the linea aspera back here. We also have the adductor magnus, which originates at the pubic bone and inserts at the linea aspera. And we have the adductor brevis, which originates at the pubic bone and inserts at the linea aspera. Those are all adductors of the hip, obviously, but we also have the gracilis, which originates at the pubic bone, but instead inserts down in the pes anserine. Next we have the bursa, and the trochanteric bursa is right on the greater trochanter, as the name suggests. We have the iliopsoas bursa, which is right on the hip joint. And we have the ischial bursa, which is right on the ischium back here. That's what you sit on. And running down our back through this area is the sciatic nerve, which innervates the butt and the rear area of the leg. I believe that is everything. Thank you.